This short video is designed to produce useful information for women and their families who have been diagnosed with a suspected or confirmed cervical cancer. What is the cervix? The cervix is part of the female reproductive system. It sits at the top of the vagina and connects the vagina to the womb. It may also be referred to as the neck of the womb. Cervical cancer starts in the cells in the cervix. It can develop on the outer surface of the cervix and on the inside of the cervical canal. Most cervical cancers develop where these parts of the cervix meet, an area called the transformation zone. How common is cervical cancer? Each year, more than 3,200 ladies are diagnosed with cervical cancer in the UK. This can affect women of all ages. From the age of 25 to 64, women are invited for cervical screening. Evidence shows that this is the best way to protect against cervical cancer. The main cause of cervical cancer is a virus called a high-risk human papillomavirus, also known as HPV. High-risk HPV sometimes causes changes in the cells of the cervix, which can develop into cervical cancer. On average, this will happen slowly and can take between 5 and 20 years. Smoking also increases your lifetime risk of developing cervical cancer. So what are the symptoms of cervical cancer? Cervical cancer may not cause any symptoms, or the symptoms may not be obvious. The most common symptoms of cervical cancer include irregular vaginal bleeding. If you have regular periods, unusual vaginal bleeding happens anytime outside your normal period. It may happen in between periods, during or after sex, or if your periods have stopped, after the menopause. You may experience changes to vaginal discharge. Vaginal discharge is a fluid or a mucus that cleans and protects the vagina. Most women experience this, but if there's any changes, you need to be aware of them. Those changes may include looking a little bit different, for example, becoming much thicker or changing in colour. Or it may smell a little bit different. If it smells unpleasant, then it needs to be reviewed. Vaginal discharge can change for lots of different reasons that are not related to cervical cancer, such as infections or change in hormone levels. You may experience some pain or discomfort during sex. This is sometimes called dyspareunia. Sex may be painful for lots of different reasons, both physical or psychological, that are not related to cervical cancer. What is a smear test? A cervical smear test is a simple test that checks for abnormal changes in the cells of the cervix. It may also be called a cervical screening test and is used as part of the cervical screening programme. If you receive an abnormal smear test, you may be referred into our colposcopy clinic. This will allow a specialist nurse or doctor to view your cervix more clearly and take biopsies if necessary. This is how cervical cancer is normally diagnosed. Grading and staging of cervical cancer. Once we have a diagnosis, we're concerned regarding the grade and the stage of a cervical cancer. The grade describes to how abnormal the cells appear under the microscope in comparison to normal cells. The stage describes its size and how far it's spread from the original site. Depending upon the stage of the cancer, you may need to undergo further investigations, for example a CT scan, an MRI scan, or even a PET-CT scan. The stage of your cancer will depend where your treatment will be offered. If you need surgical management, this will be offered at our regional oncology centre, currently based up at the Queen Elizabeth Hospital in Gateshead. Treatments for different stages of cervical cancer. Your treatment option will depend on where in your cervix the cancer is, how big it is, whether it's spread to anywhere else in your body, as well as your general health. Early stage cervical cancer. This means the cervical cancer is small and contained within the cervix. Depending on how big the cancer is and where it is in your cervix, you may be able to have a large loop excision of the transformation zone. This is also known as a LETS. Or you may well be offered bigger surgery such as a hysterectomy, or in some cases a trachelectomy. If your healthcare team feel that there is a risk that cancer may come back after surgery, you may well be offered chemotherapy and radiotherapy in combination. This is known as chemoradiotherapy. Locally advanced cervical cancer. This means that the cancer is larger and is spread outside of the cervix to nearby areas. You will normally be treated with a combination of chemotherapy and radiotherapy, known as chemoradiation. Advanced cervical cancer. Advanced cervical cancer is cancer that is spread outside of the pelvis to other parts of the body. You may be able to have chemoradiotherapy, a combination of chemotherapy and radiotherapy, if the cancer is not spread outside of the pelvis. If further spread is noted, you will be offered chemotherapy only. So what happens after treatment is finished? After completion of your treatment, your surgeon or oncologist will discuss your follow-up. This will be for at least 5 years after you complete your treatment. If you underwent surgery or chemoradiotherapy as treatment for your cervical cancer, you will no longer need further cervical screening, and your GP can remove you from the national screening programme. Is there any other support available? You'll be continued to be supported by your clinical nurse specialist, myself or Bernie, throughout your diagnosis and treatment. However, additional support is available online via the Macmillan website or more site-specific information via Joe's Trust and the Eve Appeal.